Just days after the elementary school massacre in Uvalde, Texas, a team of therapy dogs was deployed to help students and families cope with the tragedy. More than a dozen dogs and their handlers from all over the country made their way to the Texas town to provide comfort. It's not unusual to use therapy dogs to help deal with anxiety and stress. Indeed, those in the medical profession have experienced significant stress since the start of the COVID pandemic, with nearly 500,000 nurses expected to retire or leave the profession this year alone. The Arizona School of Nursing offers training and teaching to future nurses. And as producer Shauna Fisher and photographer Juan Magana report, the school has found an interesting way to help students deal with stress.
The most popular visitor at the Arizona College of Nursing is not a teacher or a student.
She's very gentle and very family friendly.
It's Lucy, the therapy dog.
She is a AKC Irish setter.
Dr. Jennifer Bonilla is Lucy's owner and the executive director of academic operations at the school.
But students here have a lot of stress as they're preparing for their nursing career. They have a very high stress environment.
To help ease that high stress level in students, Dr. Bonilla decided to try something different.
So for decades, there's been research done on therapy dogs, and in general, even for people that have their own pets at home, dogs are known to lower blood pressure, lower heart rate.
Most days, Lucy can be found walking the hallways with Dr. Bonilla or seeking out pets and snuggles in classrooms and labs.
Make it a point, if we have exams scheduled at 7 or 8 o'clock in the morning, I always come in a half an hour ahead of time. So if students are in early to prepare for the exam, do some last minute studying. I walk around the classroom, try to get their mind off their exam even for a few minutes.
But it's offering comfort during counseling sessions when students are struggling that Lucy really shines.
There's been a number of times where we've had a student that has had a rough day or come in upset because of a personal issue at home, and they're meeting with the counselor, meeting with one of our deans, and we bring the dog in, and that helps tremendously.
Dr. Bonilla says the pandemic has also been a factor in student stress level.
I think it is worse, and probably because not only have students experienced COVID themselves while they've been in school, but many of their family members have. We've had a number of students who've had deaths in their family due to COVID. So not only are they trying to really stay, very focused on their studies and doing well, but then they have all this personal issues going on in their life where they can be very upset.
Dr. Bonilla adopted Lucy when she was 8 weeks old. Once she turned a year, she placed her in a rigorous dog therapy program.
I think any breed could be a therapy dog. It's mostly the demeanor is really important. You're looking for that gentleness, the calmness, and the ability to be trained well.
While therapy dogs are being utilized more and more, it's important to note they are not service dogs. They do not perform specific daily tasks for their owner who has a disability. Instead, they work in tandem with their owner to improve the lives of others by providing comfort or de-stressing in schools, hospitals, or nursing homes.
I am a veteran of the United States Army.
It was his time in the Army that sparked Jonathan Keene's next career choice, to become a trauma nurse.
No, in the military, it was stress too. It was the heightened sense of security. You always want to protect. You want to be able to help people, but you want to make sure that nothing comes into contact with the United States, essentially. In the nursing field, you have to be a different type of protector. You want to make sure that the person is safe rather than the group.
Having Lucy at the school helps Jonathan relax so he can refocus.
And it helps me because a lot of nursing is patient interaction, and if you go in and you're jittery and nervous, you're not going to give them the care that the patient deserves. So being able to interact with Lucy prior to doing anything really calms me down and helps me work a little bit better.
Well, I love dogs, so when I saw that Lucy was here, it just brightened my spirits.
Nursing school is a family affair for Jonathan. His wife, Camille, is also studying to be a nurse and a midwife.
I wanted to do this because my grandma was an RN, and she used to take me to work all the time, and I used to see her just helping the patients, passing medications, and just her environment and the way that she cared about these people, it just made me just want to do it.
Camille says juggling a full course load and being a mom of 6 can be challenging. Lucy helps her calm down before big exams or labs.
I just know that I'm going to be okay because Lucy was there during the stressful part.
Dr. Bonilla says the school does offer additional ways to help students deal with stress, including art therapy. But Lucy is by far the most popular choice, and for good reason, she says.
I think dogs are so non-judgmental. I mean, no matter what, when you come home after a rough day, or you're tired, or you've had some kind of stress in your life, dogs are just very accepting. They're there for you and very understanding.
Dr. Bonilla has adopted a second Irish setter, and she plans to train that puppy to be a therapy dog as well. If you're interested in seeing if your dog might make for a good therapy dog, you can start by visiting the American Kennel Club's website. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.